Hey guys, my name is Howie and I'm a nurse practitioner student. Today I wanted to make a video because a friend of mine had just called me to say that her dad had cancer. So she wanted to ask me some questions. I know I'm just a student and I'm not qualified to answer any cancer medical questions, but I do have years of experience as a coordinator for a private cancer research facility in Los Angeles. For years we took care of patients specifically from anything from a melanoma to pancreatic, lung, or brain metastatic cancer. And I wanted to give like a video for a cancer starter kit for people who just have had the information right away. And since there's so much information out there, a lot of them are good, but a lot of them are just so overwhelming for people who just started to find out that they or their family members have had cancer. So this video is for you. So first off, what is cancer? Well, the thing that I like to explain first is that cancer is your own body multiplying so out of control that it grows and then it pushes against your organs and causes them to fail. Once I feel like my friends understand that, then I tell them, is a cancer benign or is it metastatic? A cancer is named after the location from where it is found. So if the cancer was found in your brain, then you call that brain cancer. If the cancer was found in your breast, then you call that breast cancer. That doesn't mean that it's going to stay there though, and that's where the terminology comes into play. If it's benign, that means that the cancer tumor is staying right where it's at. Circulatory system in the body, and it's called the lymphatic system. And the cancer uses that system to get from one place to another. And so that's why we like to find out to see if it's a benign cancer, and usually we can surgically remove it, or if it's a metastatic cancer. If it's metastatic cancer, it becomes much more complex. So the big three things that I remember when we were treating cancer over in the facility was that hopefully we could do surgery. That means that maybe we can take out a lot of the cancer under the knife, and then we would take care of the rest with chemo. So you've got surgery, you've got chemo, and you've got experimental treatments. If you're a person with cancer, you're probably going to be looking into one of those three or all of those options. Hopefully if you have surgery, that's a good sign because it means that the doctor wants to be able to resect whatever organ is affected by the tumor, and that the surgeon can actually get in there and take all of it, if not most of it, out. The rest of the time, then you could have adjunctive therapy. That way that the doctor, after you get seen by the surgeon and the surgeon cuts out the tumor, then you can get the remaining leftover cancer with just chemotherapy or radiation therapy. The other avenue that you can take is experimental therapy, which involves new and unproven medications. Alright, number 2, support for family and friends. What do you do if you're not the patient? Well, then you've got a big job. The patient's got to have their treatment taken care of, so you have to be prepared for the outcomes. Basically, you have to know that things might turn out for the worst, just as much as they turn out for the better. There's too many people that are always completely positive, that they're so positive that they're in denial. I want you to be able to traverse in between the two and be able to be there for the patient, to be there for your mom, dad, or whoever has cancer. So how do you do that? You're going to have to prioritize your life. First, you have to make sure that your life is in control, that you can handle your finances, as well as have enough time out of work to be able to give your time to your loved one. Next, you have to have an inner circle. Basically, the patient is in the dot in that inner circle. And what happens is that you're close to that dot. You're close to your mom, dad, brother, or friend who has cancer. You have to support him or her. Then they have outside friends. Once they start hearing the news that he or she has cancer, then they're going to want to say stupid things like, oh, well, I'm so sorry you have cancer, but my dog has cancer too, and he got over it, so I'm sure you will. No, that's completely dumb. Basically, what to say if you have a friend or family member that has cancer is this. You say, I'm sorry, that sucks. What can I do to support you? Let's do that again. When somebody finds out that they have cancer and they tell you, this is what you say. You say, I'm sorry, that sucks, what can I do to help you? And what can I do to support you? That's all they have to say. Family members can say more things in and out because they're closer to the patient, but those on the outside of the circle, they don't say anything too far from that. Because the cancer patient just wants time. If the cancer patient wants to get treated medically and they have medical problems, the doctors and the nurses will handle that. If the patient has any emotional needs and they need support from them, from the family members, then the family members are the ones that are going to take care of him or her. So, as an outside family member though, trying to give advice is the worst thing that you can do for a cancer patient. Well, not the worst thing, but it's definitely up there. So some final thoughts about what to do for this, and what's in this cancer starter kit is, number one, be prepared. If you are close to your family member or friend that has cancer, be prepared for the worst, but hope for the best. I'm going to say that again, be prepared. Remember that this outcome is a possibility, and they will need all your support and anything you can give. But you shouldn't lose yourself. You should be there and give as much love as you can without sacrificing yourself. And number two, it's not your fault. Cancer, for 100 years we've known about cancer, and we still haven't really found a way to deal with it effectively, except for maybe one or two specific cancers. But cancer's a bitch. It's really one of the hardest things that you and your family are going to have to deal with. And finally, don't forget about the patient. All the time, it'll feel like you're circling the globe, trying to do everything for your loved one, and then you forget to just spend time with him or her. You forget to just listen and just take some time and figure out how he or she feels so she can vent out. Because that's pretty much all you can do right now. The doctors are doing their best to treat the patient, and the nurses are doing their best to keep him alive and as comfortable as possible. You need to let them do their job, and then you need to do your job of making sure that the patient still remembers that he or she is still a human being and that you love him or her. I hope this helps. Let me know if you have any questions. My name is Howie, and I'm a nurse practitioner student. Please leave a comment down below, and I hope to hear from you soon. Thanks a lot. Bye-bye.